This chapter focuses on the integumentary system, so this is what we think of as our skin, and all the diseases and disorders that are associated with the integumentary system. And we're going to learn exactly, what composes the integumentary system in just a little bit. This is a deceivingly difficult chapter just because there are so many skin conditions that can arise, and in my personal opinion, it's not necessarily the most interesting chapter in the world, but it's still important information to know. The first part of this chapter is going to give you a brief background on the integumentary system so that we know what the structures are, what is the main function, and then we'll actually get into the medical terms associated. This is similar to the layout for all the systems throughout the book. Though the key player in this system is the skin, we also have to include other accessory structures like your nails, your hair, and there are a few glands that are in the skin that are a part of this system as well. Most people can understand or think that the integumentary system is basically a barrier, and it protects us from dangerous things from getting inside our body, like invading organisms and bacteria. That's kind of the easiest function to think of. But it also protects us from water loss and from damaging effects of UV light, to a point. If you are overexposed to UV light, then that's when certain skin cancers arise. But for the most part, it protects us from those harmful UV rays. And finally, it does other things you might not think of, like regulate body temperature. So when you're cold, you shiver. When you're hot, you sweat, those kinds of things. And it also helps make vitamin D, which is why they say, go out in the sun to get some vitamin D. That exposure helps your skin to produce that vitamin that you need. This is the picture found on page 93 of your textbook. It's a cross-sectional cartoon of the skin, and we're going to go through some of the key players. You're not going to be expected to know all of this picture and label it or anything. It's just giving you an idea of where things are located, and you'll have to know what the key players are. The skin really has two different layers. We have the epidermis, which means upper skin, or in this case our outer layer of skin. And this is the one that's, dry, flakes off, composed of keratin and melanin. Keratin is that scaly part that comes off, and as we know is dry skin, or when skin cells die and we get new ones. The other melanin is the color or the pigmentation of our skin. So if you are out in the sun, then you produce more melanin. So that's how you get that tanner color. We also have a dermis, which is our true skin, and that's the inner underlayer of skin. So if you've ever cut yourself off, sometimes you can cut through the epidermis without, damaging the dermis itself. And when we get later on in terms of burns, depending on how deep those burns go, can determine the degree. There are two glands within the integumentary system. The first is pronounced sudoriferous glands, and this is your sweat glands. So these glands are kind of the white squiggly structure located in the dermis region, and then it comes out in pores through the epidermis. And they're tiny, they're coiled, and this is where the sweat comes out of us when we actually get hot. The other gland is the sebaceous glands, and these are our oil glands. So they secrete sebum, which is why they're called sebaceous glands. Sebum is a fancy word for oil, and these are located usually around the hair follicles, so it helps the hair come through the skin It acts as a lubricant. And it also goes through your face as well. You have tiny hairs on your face. So that's, when you think of your skin breaking out in acne, it's because you might have overactive sebaceous glands. The accessory structures that are associated here besides just the skin are hair. And hair is really just keratinized cells. So this keratin is like that rough, horny tissue, and it is arising from the hair follicles. So here's a picture of what a hair follicle looks like. And you can see how most of the hair and the follicle itself lies in the dermis, and then it comes out through the epidermis, and it's the hair shaft that we see on the outside. The other accessory structure are the nails, and these are found in the epidermis. They don't go down through the dermis. If you've ever slammed your nail onto something, shut your finger in a car door, lost your nail, for example, it will grow back, and that's kind of because it doesn't go down into the dermis. And we find these on all of our fingers and our toes. Nails are also composed of that keratinized cells that hair is. So now that you have a basic understanding of what the integumentary system is, what its job is, and what the key parts are, now we are going to learn the combining forms of those different parts that are going to be used in the medical terms later on. This chart is on page 95 of your textbook, and at first I want to draw your attention to the word roots for skin. We have cutaneo, dermo, and dermato. They all mean skin, and for your purposes, we can use them interchangeably when making medical words, but they are in medical practice used specifically depending on the context of the condition or what you're talking about. Hydro, with an I, means sweat. So when we're going to be talking about the sweat glands or the sudoriferous glands, we're going to use hydro. Kerato goes along with the keratin that we've been describing. This is that horny, hard tissue that composes hair and nails. Anchio and unguo are two combining forms for nail. So most of the time we're going to use anchio, but sometimes we'll find one or two words that use unguo. Sebo goes along with sebum, which is the oil that your body produces through the sebaceous glands. And the last one is tricho. Tricho means hair. These ones are a little bit difficult because they don't really sound like what they mean. So make sure that you use your flashcards to practice what these are. Here's an exercise right underneath the chart in your book to practice going through and writing those combining forms. If you don't do them along with me here in the PowerPoint, I suggest that as soon as you start feeling more comfortable with the words, that you kind of use these as a test preparation practice exercise. Here's the first major list. These are the combining forms that are used with the integumentary system. So they don't reference a specific organ or structure, but we use them when we talk about organs and structures of the integumentary system. So we have auto, which means self. I'm pretty sure most of you know that one already. Bio means life. For example, biology is the study of life. Conio. Conio means dust. So we're going to have a few conditions of the skin associated with dust. Crypto, think cryptic or hidden in some way. Hetero means different or other. Myco is fungus. Not to be confused with myo, meaning muscle. Myco with a C is fungus. And you can imagine there are several fungal infections and issues with the skin. Necro means death. So if a certain part of the skin dies off, that's necro. You think of that necrotizing fasciitis or the flesh-eating bacteria. Pachyo. Pachyo means thick. So if you think about maybe thicker hair versus thinner hair, you might see pachyo. Rhytido is the fancy root word for wrinkles. So obviously your skin can wrinkle over time, and that's what rhytido is. Staphylo and strepto. These are two structural terms often associated with different bacteria. Staphylo are clusters, and strepto are twisted chains. So those two words have to do with how the bacteria is structured. And the last one is xero. Xero is dry, usually associated, dry skin versus oily skin. These prefixes are pretty general. We're going to start to use them in this chapter and then use them throughout. As we saw, epi means on or above, think epidermis, whereas sub means under or below. So those are kind of opposites. We have intra, which means within, not to be confused with inter. Intra means within. Para means beyond or beside, around or abnormal. It has a lot of different meanings. Usually it means beside. Per means through. So if you're going from one location through to another, maybe you have a cut through the epidermis, that kind of thing, that's what we would use per. And the last one, trans. Trans means through also, but it means usually across or beyond. And we'll see all of these prefixes used in terms a little bit later on. Here we get to the suffixes. The first one is just a, and we tack a onto the end of a word oftentimes because we want to turn it into a noun. A itself has no meaning whatsoever. It just turns the word or medical term into a noun. So for naming a specific condition or something. Coccus or cocci for plural means berry-shaped, and that is going to be used in combination with the staphylo and strepto that we saw before to give an accurate representation of how a certain bacteria looks. Ectomy, we're going to be seeing this one tons of times. Ectomy means excision. So you're taking out something. So for example, appendectomy means you're taking out your appendix. IA means a condition of. So in this case, it is usually a diseased or abnormal state added on to the end of the word to turn it into a noun disease. Itis. Itis means inflammation. So appendicitis is inflammation of the appendix, and we're going to have inflammation throughout all the different body systems that we see. Malacia. Malacia means a softening. So if you have a structure that gets softer, maybe it's your bones, osteomalacia would be a softening of the bones, for example. Opsy means a view of, so you're looking at something. For example, an autopsy means a view of self. Phagia with a G means eating. So an autophagia means eating of self, or we're going to see a few different words with that. Plasty. Plasty means a surgical repair. So you're fixing something. You're not taking out anything, you're just going in and fixing whatever was wrong. Rhea. Rhea means flow or discharge. So if you think about the word diarrhea, dia we learned previously means through. So diarrhea would be a flow or discharge through, or complete flow or discharge. And the last one, tome. A tome is a cutting instrument. So laparotome is a fancy basic word for a scalpel. It's a cutting tool. Notice in these suffixes there are a few: ectomy, plasty, tome. These are surgical terms. And throughout each of the chapters in the book, there's going to be a section for diagnostic and surgical terms. At this point, we can now combine the word roots, prefixes, and suffixes that we've learned and put them together and create diseases and disorders that are built from word parts. And then in this chapter, we're going to be introduced to a giant list of diseases and disorders that are not built from word parts. Many of the words on this list look quite long, but I don't want you to freak out. Go ahead and break up these words into their different sections. Put little slashes through where the word roots connect and the suffixes, and start defining it from the end and then going back to the beginning to finish off the word. Here we only have one itis, dermatitis, which is inflammation of the skin. Also notice here we have dermato being the key word meaning skin here, but we do have those other two word roots that mean skin. We have dermatoconiosis, so dermato, skin, conio, con, e means dust, and osis is abnormal condition. So you have some kind of abnormal skin condition that's caused by dust. You can also have a tumor, an oma, in the skin. So a dermatofibroma would be a fibrous tumor of the skin. Let's see. You can have smooth skin, leodermia. You can have white skin, leukoderma. And this really means that you kind of have white patches on your skin. It doesn't mean that you're, pale. It means you have white patches. Onchocryptosis. Again, osis means an abnormal condition. Onchio means nail, and crypto means hidden. So onchocryptosis is a hidden nail. This is a fancy way of saying you have an ingrown nail, if you've ever had an ingrown finger or toenail. You could also have onchomalacia, so a softening of your nails, so they kind of lose that hardened keratin feel and become soft, more pliable. You can also have a fungal infection in your nail, which is onchomycosis. If you are a nail biter, you would have onchophagia, which is basically the condition of eating your nails. And then depending on how your skin is, you can have pachyderma, which means you can have thick, rough patches. And then we also have oil conditions. So if you have really oily skin, you might have seborrhea, which translates to a discharge of sebum or oil out of the skin. A gross one would be trichomycosis. Tricho means hair, myco means fungus, so you have basically fungus in your hair. And if you have dry skin, you have xeroderma. So take a break at this point, work on exercise 11 or 12 to feel confident with the ones built from word parts before you move on to the ones that are not. Here's an example of some common dermatitis conditions. So on the left we have what's called contact dermatitis. So your skin is basically irritated by coming into contact with another substance. So we have an example on the wrist here. A watch might be rubbed against the skin, and then we also have where the button of the pants or the zipper rubbed against the stomach. Both of those caused dermatitis. On the right, you have seborrheic dermatitis. So seborrhea has to do with oil discharge. So the excessive oil discharge has caused irritation of the skin. Similar to your textbook, we have a few pictures, and you have to come up with the medical term that goes along with it. So if you're looking at the left, we basically have fungus on the nail. So abnormal condition, always start at the end, is osis. And then you have nail, which is anchio. You could use unguo here too, but most of the time we're going to use anchio. And then fungus is myco. We leave off that O in myco because the suffix osis already has an O. For number 2, it means a diseased state around the nail. In this case, diseased state would be IA, and then around is para. We're going to leave off that A because anchio, which is the nail part, already starts with an O, so we don't need to have two vowels next to each other. At this point, just take some extra time to practice breaking up and defining these words. So making sure you put the slashes through the word with the different word roots and the prefixes and the suffixes, and defining it a piece at a time. That way you can easily break down any word no matter how long it is or scary it looks. This chapter probably has the most diseases that are not built from word parts, meaning you're going to have to memorize them. This is the first half of the list, and there's a table defining these on page 103 of your book. The first is an abrasion. Abrasion is any scraping away of skin by mechanical process, meaning usually something rubbed up on your skin and you get a scrape. That would be an abrasion. An abscess is anywhere you have a collection of pus on your body, whether it's a pus-filled blister, for example, pus-filled acne. Those are all considered under the generic term abscess. Acne, besides every teenager's worst nightmare, is an actually inflammatory disease, and it involves the sebaceous glands, so your oil glands, and the hair follicles. So there's kind of a inflammatory reaction around the hair follicle that leads to acne. And if you go to the website, you can see an animation about it. The next term is actinic keratosis. So this is a skin condition that's often seen before you get skin cancer, and it is where you've been overexposed to sunlight and you get these hard patches forming on the skin. Again, usually this is kind of the precursor to getting skin cancer. 5, you might already know, albinism. This is where you are lacking pigment in the skin, the hair, and the eyes. It's a congenital hereditary condition, so it's inherited. And the lack of pigment means that you look completely white, and the lack of pigment in your eyes makes them look red. 6 is a basal cell carcinoma, abbreviated BCC, and this is a cancerous tumor that arises from excessive skin exposure. If you're going to get skin cancer, of the different types, I guess this is the one to have because it seldom moves from one location to another, and usually it's treated by just removing the infected area. But it is, cancerous tissue on the skin. The next one is candidiasis, and it's most of the time called thrush in practice, and it's a skin infection caused by a fungus. And it can oftentimes be seen in AIDS patients, and because it's a yeast infection, it oftentimes attacks women as well. The next term is a carbuncle. Silly term, but it is a skin infection where you have a bunch of boils or a cluster of them together. And we're going to learn that number 13, a furuncle, is an individual boil. A boil is something that is caused by the staphylococcal bacteria in your hair follicle, and there's a picture of it on 105 in your textbook. So if you have just one of them, it's called a furuncle. But if you have, a larger infection in a collection of these, then it's called a carbuncle. Number 9, cellulitis, is inflammation of the skin, which is where the itis comes from, caused by some kind of infection. So usually you have redness and a fever of some kind. A contusion, number 10, is a fancy word for a bruise. So there's no break in the skin, but there is usually pain, swelling, and oftentimes you get that, blue-black color as a bruise. Eczema is a common condition where you get redness, blisters, scabs, itching. It's not infectious, but usually it's associated with, very sensitive skin. A fissure is any slit or crack like sore in the skin. So oftentimes maybe in the winter you have to keep moisturizing your hands, otherwise they crack. Those would be fissures. We already talked about furuncle. Gangrene. Gangrene is where you have tissue that has been cut off from the blood supply after a bacterial infection, and then that tissue dies. This is a form of necrosis or tissue death. Again, you have some kind of bacterial infection, and then that infection causes certain blood supply to be cut off, and then the tissue dies. 15, herpes. Herpes is considered a skin infection as well. This will come back when we talk about, the reproductive herpes, but in this case, it can give you small blisters or in clusters. There are many different types of herpes, one of which, herpes zoster, actually causes shingles. And shingles is what you get after you have the chickenpox and it comes back again. It is called shingles, and it gives you painful skin eruptions and usually is quite painful. Impetigo. Impetigo has little pustules on the outside of your skin, and this is basically caused by a infection of either staphylococci or streptococci, and they're in a picture on page 106. Infection, I'm going to assume you already know what that one means. Please look at the pictures on page 104, 105, and 106. They're really good indicators of what many of the different skin infections are, because some of them are hard to keep straight from one another. Here's the second half of the giant list. The first is Kaposi sarcoma. So this is a cancerous tumor usually associated with AIDS patients, and there is a picture of it on page 104, and it gives you these little purple or brown papules on the skin and the lower extremities that can spread over time. A laceration is the fancy word for a cut usually, so it's some kind of jagged edged wound, not a nice straight line. A lesion is a very generic term. It's any change after an injury. So if you have a sore or a wound or an ulcer or a tumor, all of those different terms fit under the category of a lesion. And there's different types of lesions, and it's kind of described to you in a little box on page 107. The next term is MRSA infection, MRSA, which stands for methicillin-resistant Staphylococcus aureus. And this is basically a certain bacterial infection where it has become resistant to the methicillin antibiotic. And this is the one that you often catch in hospitals or long-term care facilities, just because that's where these, really superbug bacteria live. All right, moving on, we have pediculosis. Pediculosis is the fancy word for lice. So anytime you have a skin invasion into your hair caused by lice, that is pediculosis. The next is psoriasis. The P is silent. Psoriasis is a chronic skin condition. So chronic means that it, is long-term. You can have episodes where you have red lesions covered by silvery scales. The next is rosacea. Think rosy is often associated with that rose-colored skin, and makes it's really a series of broken blood vessels under the skin, and those broken blood vessels give you that bright red base. The next is scabies. Scabies is a skin infection caused by the itch mite. There's a picture of it on 106 in your book, but this little itch mite comes in, burrows under your skin, and lays all the little eggs, and then that's what causes this extreme skin infection and itching. Scleroderma. Sclero means hardening, and we're going to see that often later in the circulatory chapter. But scleroderma would be a hardening of the skin. So if you have patches along the skin that are hardening, it's scleroderma. The next is squamous cell carcinoma. This is the bad skin cancer to get if you're going to have to get one. It's malignant growth that develops from the epithelial tissue, and this one has this strong potential to metastasize. So oftentimes it moves from wherever it starts to a new location in the body. And this is often, again, caused by excessive exposure to sunlight. The next term, systemic lupus erythematosus, and this is a chronic inflammatory disease that involves your skin, your joints, your kidneys, your nervous system. It's a chronic autoimmune disease. So again, this is where your body is attacking itself, and it's a chronic condition. The next term is tinea. Tinea is the medical way of saying ringworm or athlete's foot. Those are the two that we most commonly use, and this is a fungal infection. So ringworm and athlete's foot are a fungal infection, and the fungus infects the keratin of your hair follicles or your nails. Next we have urticaria. Urticaria is the fancy word for hives. If you break out in hives, the itchy eruption of these little individual hives all over your body, and can include swelling of the airway, kind of in a allergic reaction type of way as well. The last one is vitiligo, and this is white patches on the skin. And this happens because the melanocytes, or the cells that produce melanin to create skin pigment, are destroyed in an autoimmune fashion. Michael Jackson is the fancy example for this, where slowly but surely he lost melanocytes, so his skin turned from black to white. This was a lot of words, so I want you to really take some time to absorb these 31 words. Exercise 15 is going to be the more difficult one using these words. To get yourself used to using these at least once, start with the matching, exercise 16 and 17. Then when you're feeling really good with the words, go back and do exercise 15. These are the same pictures that you see in your book. I just wanted to re-put them on this slide for you here. A, actinic keratosis. That's the precursor to skin cancer usually. Due to excessive sunlight, you get those hardened patches. B is squamous cell carcinoma. So this is the worst of the skin carcinomas, as seen as a growth on the lips here. C is the basal cell carcinoma. This is the one that usually remains localized, so you would most likely just cut out that piece on the nose and the person would be fine. D, we learned this term earlier in a different chapter. A melanoma is a tumor of black, so you have a black skin tumor here. And then E is Kaposi sarcoma. So these are the malignant little tumors that you get on the skin. Mostly associated with AIDS patients, but not exclusively. Here on the left, you have a picture of what rosacea looks like. You have those broken blood vessels under the skin that causes that red coloration. And again, this is a chronic condition, so you would have episodes over time of maybe getting better and then getting worse. On the right, you have vitiligo. You can see how the patches on the skin where the melanocytes have been destroyed are significantly whiter than other areas of the face on this particular patient. Many of the words on the disease and disorder list were different types of infections. So I just wanted to take a second to show you the different types of skin infections a person can get. One example, bacterial infections. So these would be the furuncles and carbuncles, cellulitis, impetigo, MRSA, and parenchyma. Whereas fungal infections include candidiasis, tinea, and trichomycosis. Parasites are scabies and pediculosis, which we know as lice. And then viral infections, so fever blisters and shingles, two different versions of herpes. So your skin is very susceptible to infections from all of these different avenues, which is why we have so many disease and disorder terms. The book gives you pictured examples of a few representative infections of each category. So here they're using impetigo as a bacterial example and tinea as a fungal example. Here they're showing you scabies as a parasitic infection example and herpes zoster, which causes shingles, as a viral infection of the skin. Once you complete the disease and disorder terms in a specific chapter, then we move on to surgical terms. And sometimes you have surgical terms that are built from word parts, and sometimes you have ones that are not built from word parts, just like we saw with diseases and disorders. So first we're going to tackle the ones that are built from word parts. The first term on this list means biopsy. And if you think about the word parts in here, we have opsy, which means view of, and bio, which means life. So it means view of life. In real medical practice, a biopsy is where you take a piece of tissue and look at it under the microscope. And this is usually how they diagnose cancer. They take a biopsy or a piece of the suspected cancerous tissue, look at it in the microscope, and tell whether or not it indeed is cancer. It's abbreviated BX. And there is an animation for this on the website if you want to look it up. The next two terms look really long and complicated. We just have to break them up. Dermatoautoplasty. Plasty means surgical repair. So a surgical repair, dermato means skin, and auto means self. So surgical repair using one's own skin. This is called an autograft. If you think about people that get burns, sometimes they do what's called a skin graft. So if you take a piece of skin from one area of your body and move it to the burned area, for example. If you're taking it from the patient themselves, it would be a dermatoautoplasty. In other instances, you take a graft from another individual, and that is a dermatoheteroplasty, where you surgically repair the skin from someone else. It's also called an allograft. A dermatome would be the surgical instrument for the skin, or the instrument used to cut the skin. Let's see. Dermatoplasty would be the generic term for surgical repair of the skin. There could be many different reasons that you would need to repair the skin. That's just the general term. Anchiectomy. Ectomy means removal, and in this case, anchio means nail. So you would be removing a nail for some reason. Other terms we have here include rhytido as the word root / combining form, and this has to do with wrinkles. So a rhytidectomy would be a removal of wrinkles, which is the fancy medical way of saying you are getting a facelift. Whereas a rhytidoplasty pretty much means the same thing. You are surgically repairing wrinkles. These two terms are used often interchangeably, whether you're repairing them or removing them. Either way, you're getting rid of them. There are a few surgical terms that are not built from word parts. The first of which is cauterization. If you've ever heard of something being cauterized, it basically means you're destroying the tissue, usually with hot, but it could be cold as well. You can even use electrical current or some kind of chemical. For example, if you cauterize a wound, you use something really hot to burn the wound to stop the bleeding. Another term, cryosurgery. Cryo means extreme cold. So you're going to be doing a surgical procedure where you destroy tissue using extreme cold. Usually that means liquid nitrogen. And this is a common procedure that they use to remove moles. If you've ever had a mole removed, oftentimes you go to the doctor, they freeze it off. That's what cryosurgery is. Debridement means that you have an open wound with either foreign material or dead tissue in the wound. So debridement just means that they remove or clear out all the foreign objects in your open wound to clean it up. Dermabrasion is where they remove skin scars using some kind of material, usually like sandpaper. So if you think of microdermabrasion as a common procedure, they pretty much use tiny sandpaper to sand the outer layer of skin off your face, and then it makes you look, new and refreshed and young looking. Excision just means removal by cutting, so they're taking something out. Incision means you're cutting into the person using a sharp instrument. When you put it together with drainage, you have incision and drainage, which means that maybe there was some kind of buildup of fluid under the skin, so you purposefully cut into the skin to allow whatever fluid buildup to drain. Laser surgery. Again, this is where you would use a laser to destroy tissue, so instead of using extreme hot or cold, you're using a laser. Mohs surgery. Mohs surgery, this is an example of an eponym because it's developed by a person with the last name Mohs, and this person developed it in Wisconsin. And it's a technique used to get excised portions on the skin of skin cancer. So it's a technique that doctors use to, cut off the smallest amount possible of skin that they have to when they remove cancerous tissue. If you have a big tumor on your face, you want them to take as little as possible so that you can kind of retain the physical features that you have. The last term, suturing. Suturing just means that you are stitching up the edges of an open wound. So there are different types of sutures you can get. They're shown in your book on page 115. Depending on what the wound is or doctor's preference, there are different ways to suture. Now we get to the complementary terms. Again, the complementary terms are terms that are going to be used with the diseases and disorders and the anatomical referencing of the different diseases and disorders. There are built from word parts, and there are also ones not built from word parts. You should be able to use what you learned at the beginning of the chapter as well as previous chapters to put these words together. So once a word part is introduced in the chapter, it's fair game for all the rest of the chapters that come after it. So for example, we didn't specifically introduce logist and logi in this chapter, but we are seeing them back again as a suffix here. A dermatologist would then be a person who studies the skin. And dermatology would be the area of study of the skin. And it's abbreviated derm. Epidermal means above the skin or pertaining to above the skin. Erythroderma means red skin or abnormal condition of red skin. Hypodermic, pertaining to below the skin. I do want to draw your attention. Hypodermic means the same thing really as subcutaneous. They both mean pertaining to below the skin. So either one is considered correct. Intradermal, abbreviated ID, means within the skin. So sometimes you have an intradermal injection where you are injecting in between the epidermis layer and the dermis layer. Other ones on here that are maybe of special note: transdermal is abbreviated TD, and it means pertaining to through the skin. You could also say percutaneous. That means through the skin as well. And again, this is usually used for maybe a needle insertion through the skin under the layers of the skin. I didn't go through all of the terms here, and I won't always on every slide, but you should be able to begin to put these together. You will still be responsible for knowing all of these words. Cocci or streptococcus looks like. Notice the berry shapes and the twisted chains. Those are the two key identifiers here: berry shape and twisted chains. This is a common cause. Here's a picture of different routes of administering medication through different avenues in the skin. The first, as I mentioned before, intradermal, means within the skin, so between the epidermal and dermal layers. 2 is subcutaneous or hypodermic. They both mean the same thing. You would go below the skin, so perhaps you would inject into the muscle underneath the skin. The third is transdermal or across the skin. One example of this would be using a patch to deliver medication from the top of the skin into the body system through the actual skin itself. There are a lot of complementary terms that are not built from word parts. Here is the first half of the list. The ones that are not built from word parts do not have flashcards, so if these are tricky for you, please do so. There are pictures in your book to help you with this a little bit on page 122 and 123. Please reference those for some of these that are tricky. Alopecia is the disease where you lose all of your hair. So this means you don't have any hair on your head, or you don't have any eyebrows or eyelashes. All hair is lost. I'm going to assume you know what bacteria is. 3 is a cicatrix. Sounds pretty cool, but it's the fancy way of saying you have a scar of some kind. It's a cicatrix. 4 is a cyst. A cyst means you have some kind of sac that has fluid in it. In this case, it could be water, it could be blood, it could be pus. Anything that's closed with a fluid inside is called a cyst. Cytomegalovirus, or CMV, is a herpes kind of virus that causes disease. And usually this only happens when you are immunocompromised, so this is something that happens a lot in AIDS patients. Number 6, diaphoresis. That's the fancy word for sweating. So if you are an excessive sweater, you might have diaphoresis or hyperdiaphoresis. 7 is ecchymosis. Ecchymosis means that your blood is escaping into the skin. And usually this happens after maybe you had your blood drawn or you got an injection. The blood doesn't actually come out through the skin, but it stays within the skin and gives a blue discolored look. 8 is edema. Edema means that you have this puff or swelling from fluid buildup. So if you have fluid building up in an area of the body, we'll see this again in other systems as well, and it puffs out, then it's called edema. Number 9 is erythema. You can see the urethral part in there, and that's the fancy word for redness. So if you have redness on your skin somewhere, you'd use that term. I'm going to assume you know what fungus is, and then induration means, think dura for hard. It's a hard spot on the skin. So if you're feeling on your skin and there's a patch that's particularly hard compared to the rest, that is induration. The words in this half of the list are probably some of the hardest to keep straight, because there's all different kinds of skin lesions that you can have, and depending on what they are, they're given a slightly different name, even though they sound pretty similar. The first term on this list is jaundice, also known as xanthoderma. That's the yellowing of the skin. The next is a keloid. A keloid is where you have an overgrowth of scar tissue. There's an example on page 122. So the scar isn't flat on the skin, it kind of bubbles up and overgrows. Usually associated with burns, but not always. Leukoplakia. Leuko means white, and that's the only part you can really pull from word parts. And so it's white spots or patches on the skin. A macule. This is where the table on page 123 is really going to come in handy. A macule is the fancy word for a freckle. It's a flat colored spot on the skin. There's no elevation, it's just a little dark spot. So a freckle is an example of a macule. The next is nevus, and this is a brown or black color and sometimes present at birth, like a birthmark, but it's another way of saying a mole. So if you have a birthmark or a slightly elevated malformation, usually brown or black, not always, that's a nevus. A nodule is a small knot-like mass that can be felt by touch. So if you look in the table on page 123, a lipoma, there's certain carcinomas and whatnot. It's a small knot-like mass, so it feels hard to the touch. Pallor. Pallor is skin color or paleness. So if you have, a really pale pallor, it means you're really pale compared to others. It's kind of a scale. Papule is a small solid skin elevation. So a skin tag, for example, if you know what a skin tag is, or basal cell carcinoma, that tumorous growth, those are considered papules. There's an elevation there. The next term is petechia. You often see this in eyes. You get this small little pinpoint hemorrhages, but you can see them on the skin as well. 21 is a pressure ulcer. So an ulcer in general, as seen later on the list, is just an erosion of skin. And this can be the skin on the outside of your body. It can also be the skin lining a particular organ. And so we'll see, gastric ulcers later on in the digestive system. But here we have a pressure ulcer. And really that just means that similar to contact dermatitis, the skin has been rubbed away to the point where it is irritated and is causing severe issues. Oftentimes this is called a bed sore as well. So if you're laying in bed for a really long time, not necessarily keeping everything as clean as you should, getting circulation to certain areas of the body, then you can wear away the skin lining and cause issues. Number 22 is pruritus, which is the fancy word for itching. So if you have itchy skin of some kind, it's pruritus. Purpura is a small hemorrhage on the skin, giving you a discoloration. A pustule is an elevated skin condition where there's pus. So acne is one example of a pustule because it's a small little elevation that has pus. And let's see. This also fits into the same general category as a cyst as well, because a cyst is any sac that has fluid. So if that sac has pus in it, then that cyst is a pustule. A verruca. A verruca is a fancy word for a wart. And it's a little elevation on the skin, and warts are caused by viruses. So that's what gives it a separate term than having just a papule name. We also have a vesicle. A vesicle is a small elevation that has liquid inside, similar to a cyst, but in this case we're calling it a vesicle or a blister. Virus you should know, and a wheal, as seen on page 123, is a round itchy elevation on the skin. So the key here to a wheal is that it itches. So hives are a good example. Again, all of these different skin lesion types are very difficult to keep separate. So this particular group of words is going to need a lot of review. You will be responsible for knowing the difference between all of these. As I mentioned, a keloid is an overgrowth of scar tissue. So this is an example of the burn keloid, where a person was burned on an area of the body, and in the scarring healing process it overgrew, so you have elevation in those particular areas. This is that example of a pressure ulcer, also known as a bed sore. So this individual had been laying in bed over a prolonged period of time, and that pressure, lack of circulation, led to the wearing away of the skin. There is a set of stages associated with this, so this is an example of stage 2, but eventually it would get worse and worse and can wear all the way down to the bone if left untreated. This is that helpful chart on page 123 of your textbook that I suggest you become very familiar with for your own self to remember what the different skin lesions are. This is also continued on the next slide. Here are the abbreviations for this chapter. Notice there are, significantly more in this chapter compared to the ones we've done this far. Some of them are pretty easy and straightforward, like staph or strep. Even BCC for basal cell carcinoma and SQCCA for squamous cell carcinoma. We have BX meaning biopsy. Notice how MRSA is on here a few different times. MRSA alone means methicillin-resistant Staphylococcus aureus. If you put CA onto the front, then that means it's community associated. So you got MRSA or got this disorder out in the world, not associated with healthcare. HA is healthcare associated. So you would have caught this disease in a health facility, a hospital, a nursing home, something like that. As I recommend with all the chapters, once you've gone through and are feeling comfortable with many of the words, work on the end exercises of the chapter that combine all of them together. In this case, reading the medical document from beginning to end, understanding what it means, and pronouncing all of these words correctly.